Hello, Assalamu alaikum and good morning. I am Dr. DIYYAT, Professor of Forensic Medicine and Toxicology. And we have started discussion on the mechanical injuries. So this is the second lecture of this series. And in this lecture, the learning objective will be that we will discuss the classification of trauma or injuries. And this classification is either the anatomical classification, that is upon the structural appearance, or as the medico-legal classification, the legal terms, the sections which the law imposes will fix the amount of damage according to the nature of injury as described by the law. Then upon the manner of infliction, that it is suicidal, homicidal or accidental. Then upon the depending upon the nature of the causative agent, that is it is caused by blunt force, sharp edge or any other weapon. So in this lecture we will basically discuss the classification of injuries. So take care, starting with the lecture. Allah Hafiz. Starting with the lecture, as we are discussing the mechanical injuries, and this is the second lecture, traumatology. In the previous lecture, we discussed that it is the study of trauma. So in this lecture, as I have told you already, we will discuss the classification of injuries. The first is the anatomical classification. This is basically structural appearance wise classification. That is, the wound can be closed wound, open wound, or burns. Burns are set as a different type of wounds because they involve a definite pattern. Then the closed wounds can be abrasions, contusions, or bruises. And the open wound can be lacerated wound, incised wounds, penetrating wounds, stabs or punctured wounds, firearm injuries, and blast injuries. The burns, they are either the dry flame burns or wet burns, sunburns, corrosives, because the strong acids and alkalis, they corrode the tissues and they are called corrosive burns. Then electrical burns, because of electricity, there is coagulation of the proteins and that is called joule burn. So electrical burns because of electricity. Similarly, the lightning burns. The natural light, if strikes to any individual, it also causes burning. Then the X-ray burns, which are the radiation burns. Now the medico-legal classification is basically this is based on the legal base, legal terms. We have to fix the nature of the injury according to the nature of injury according to the legal framework. The injuries can be any. They can be mechanical injuries, thermal injuries, chemical injuries, or electrical injuries. But the injury, we have to determine the amount of damage as per legal sections. As Pakistan Penal Code describes various sections for each injury. And now in Pakistan, the law for the injuries, which was previously PPC 319 and PPC 320, now has been replaced by QISAS and DIYYAT law. QISAS is
equal amount of damage, and DIYYAT is the compensation. So we have to know, fix the nature of injury according to QISAS and DIYYAT ordinance or law. Now the hurt and murder, which is qatl, they come under this law. Now on the manner of infliction, this can be suicidal, homicidal, or accidental. On the basis of the causative agent, that is the kind of weapon, it can be sharp edge, blunt weapon, firearms, fire, electrical burns, chemical, radiation. So thank you very much. This was all about the classification.
So in this lecture, we have discussed the classification of injuries. And the summary of this lecture is that we have understood that we can classify injury depending upon the criteria which we establish. That is, either it can be anatomical classification upon the structural appearance, or it can be medico-legal classification. That is according to the nature of injury in the section prescribed by the law. So we have understood that we have to give the amount of damage according to the sections of the law, and then we can classify the injuries according to the manner, that it is suicidal, homicidal, or accidental. And then we can also classify the injury according to the kind of weapon. The weapon can be blunt, the weapon can be sharp edge, or any other weapon. So the summary of this lecture is that we have developed certain criteria to classify various injuries. So thank you very much. Now the next lecture will continue the topic. Thank you.
If you like my videos, please subscribe to my channel, and this is my channel. Thank you very much.